Hello again, everyone. My name is Jesse David, and I'm an instructor here at the Avi-Ad School in Tel Aviv, and I'm here to tell you a little bit about what we can offer you in terms of professional training and advancement. We have a school for professional caregivers. So what does that mean, a professional caregiver? Well, one of the ways we define it is someone who is able to handle any situation that might come up with their patient care skillfully and professionally. We prepare you to deal with a wide variety of situations that may come up, that probably will come up at some point in your career. We give you the basis of understanding, and we give you the hands-on skills and practice to make you the best caregiver you can be. Also, with this training, we provide opportunities to advance, to go on to higher training, to make yourself a more skilled professional, and to make a better living also, because the more you know and the more you can do, the more you will earn. So today we're going to talk a little bit about that, and also we're going to give you a little information about infection prevention and control. So infection prevention, why is it important? Well, nobody wants to get an infection, of course, but it's a little more serious than that even. Before the middle of the 20th century, approximately World War II, before that time, of all the wars in history, more people died from infections than from bullet wounds or explosions or spears or arrows or swords. Infections killed usually twice as many people as did the actual wounds. Why is that? Well, part of it was that antibiotics were not developed until the middle of the 20th century, and part of it was that people just didn't understand that there was a chain of causes that led to the infection, and that they could be stopped at various points. And we're going to talk about that now. Probably the most important advance, believe it or not, in infection prevention was the implementation and the use of hand washing. Just washing hands saved literally millions of lives. In the 17th century, when this was starting to very infancy of infection prevention, it was not uncommon for a doctor, a student doctor, to go from examining a corpse to the next room to deliver a baby. Maybe they would wipe their hands in their shirt, maybe they wouldn't. But someone noticed that when they did wash their hands, the infection rate in children and mothers dropped dramatically. This took a long time to be studied and to be understood, but it came to the point where when they did begin washing hands after examining corpses, the mortality rate dropped by like 70%. So it's a significant thing, even just the washing of the hands. But we do a little more, we go a little further. It's the 21st century, we know a lot about infections, we know a lot about what causes them. We want to teach you about that. One of the primary things, besides hand washing, is rubber gloves. Why rubber gloves? Well, it is a two-way protection. It protects the patient if you should have something on your hand from whatever reason. Maybe you touched something outside that someone happened to have sneezed on. Maybe any number of things you could have touched will prevent them from you passing it to the patient. Also, if your patient is infectious, it will prevent you from putting it onto your hands. So wearing gloves is a pretty simple procedure. These are non-sterile. It means that they're clean and that they're a good barrier, but it means that they're not the type that would be used in a surgery where they're absolutely clean and pure. These are just clean gloves. We put them on, protects our hands. It also makes touching things that we in the medical field touch, as you well know, things like urine, vomit, spit up food. It makes it a little easier to deal with. And we use the gloves. You still have a good amount of movement and sensation. You can take a pulse with gloves on. You can still get a good feeling for what you're touching. But they protect you, they protect the patient. When we're done with whatever procedure it is, if we're working with one patient, we can wear them for 20 minutes, 30 minutes, maybe even an hour, but on one patient. If we're going to another patient, if we're going to another room, we take them off. When we come back, we replace them. How to take them off? Well, you could just rip them off and throw them down, but remember that we're professional. We're thinking about details. We're thinking about every little place that we could stop or prevent infection from being passed on. So how do we do it? We take the first one with our gloved hand, we pull it inside out, so that anything that our glove has touched is now inside. Secondly, we take our second glove with our hand, and we peel the second glove over on top of the first glove. This kind of encloses any of the stuff that might have touched our hands into a little ball. We can throw it out. Even though we were wearing gloves, we're still going to wash our hands. Gloves are not 100% effective, and it is possible stuff can get in through them, but also just we make it a habit. We wash our hands a lot in the medical field. When I was working, I washed my hands sometimes 25, 30 times in a day. After every patient, after I cleaned equipment, after I restocked equipment. It just became a habit. When you finished doing something, you washed your hands. Was every single time preventing an infection? Probably not. But by the act of doing it, by making it part of my daily schedule, part of the way I did my job, I put a block every half hour, every hour in the chain of infection. And the chain of infection is something you'll learn about here in our school. We also have, which I'm sure we've all seen, protective mask. This one's got a little breather on it. And the point of these, well, first of all, it protects your patient, because if you cough, if you're breathing, if someone has a compromised immune system, someone is ill, someone is elderly, their immune system, their resistance is not as strong, you may be carrying a cold that your body has completely fought off, and you're just carrying it around, and it's going to eventually go out. But to someone whose resistance is down, if you cough on them, breathe on them, even though it didn't make you sick, it might make them sick. So you're protecting your patient, and also, if the patient is sick, you're protecting yourself. And remember that when you protect yourself at work, you're also protecting your family at home. You finish work, you wash your hands very carefully, you take off all the PPE, it's called, personal protective equipment, you throw it out, it's disposable. This means you're not going to carry home any of the possible infections that you dealt with during the day. It's going to protect you and your family and your patient. It's good for everybody to practice personal protective equipment and techniques. So, these are things that we'll learn about. There's a whole chapter during our course about infection prevention and control. We teach you about how the germs find a place to start, how they grow, how they spread, what you can do to stop them. We have a whole section on personal protective equipment also. So you're going to get a really broad foundation of knowledge from our school, not just in the physical aspects, but also in the psychological aspects, sociological aspects, nutrition, things that are going to make you a professional caregiver, someone who can handle any situation that comes up in the course of their daily work. And to do this, it takes time. It's not an easy course, but it is built one part on the other, so that we start off simply, we give you the basics, and from there we build you up to a level where you're able to interact with nurses and doctors professionally. You know what you're speaking about, you know the terms, you know the meanings of the things you're saying. This gives you some pride and professionalism, it makes your job easier, it makes you do your job better, and it makes it much more interesting when you know the finer details about this. So our school, we have several ways you can go through this course to learn. One is through the classroom-based program. It's approximately 1 year long. Gives you one-on-one with the tutors, as well as class time, laboratory time, and plenty of time to study and read. We use, of course, the level 3 book from VTech. We're accredited by VTech. And what that means is that there is an outside agency that checks our delivery, our content, everything in our school, and says we are up to their standard. And their standard is accepted in over 110 countries. It's a very good diploma to have. It's very versatile, it's accepted and acknowledged, and if you earn it, you can take it where you're going, and people will know what it is. So, how to find out more? Well, you can come to our office and talk to us. You can check on our website, on Facebook, and you can find out really what's involved in becoming a professional. If this is going to be your career, this is the perfect place to start. You can learn and work and prepare yourself, and from there you can go anywhere. With a level 3 diploma from Avi-Ad School, you can go on to study level 4 and 5, which is the equivalent of a practical nurse. In most countries, the pay is between $18 and $30 an hour to start, which means you're not working a 24-hour day. You're working an 8-hour day. And you're working professionally. You're working smart. You're working with physiotherapists and lab technicians and doctors and x-ray people. It's a chance to really broaden your horizons, to be the best caregiver you could be, and to really bring yourself into the medical field as a real professional. We want to give you this opportunity, and we invite you to come down and speak to us. We have a lot of programs available, including distance learning. We have programs in English to help you improve your English, writing, and reading. And more than what you'll learn, we'll teach you also how to study, how to learn anything. By taking our course, we'll make sure that when you're done, you know how to do research, you know how to write a paper, you know how to find out what you need to find out. We're not only going to teach you how to be a professional caregiver, we're going to teach you how to be a professional student, how to really get the most from anything you're studying. And that's a skill you can take with you anywhere you go and anything you study. So come down to Avi-Ad School, talk to us, see what we have to offer. We have a great program. We have a lot of great teachers and assistants and professionals to help you from after you graduate to take this diploma and really make something with it. So we invite everyone to come down, to talk to us, and to see what we have to offer. It's a great career, it's a great profession, and there's a place for you in it.